Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Elizabeth Jepsen. She's chief of staff at Kinetik, and Denise Kajanoff. She's SVP of Payer Strategy and Growth at Kinetik. Welcome.
Thanks for having us.
Yeah, excited for this discussion. We're here at Vive. Lots of exciting things happening. I think you guys are working in a really interesting area, talking about non-emergency medical transportation. But before we go there, let's learn. Elizabeth, tell us, what's the story of how Kinetik was founded?
Yeah, so we actually have a pretty interesting story. Our founder and CEO, Sufyan, he got a call from his friend who worked for a transportation company in Brooklyn, New York, and he was like, hey man, I have a database issue. I'd love if you could kind of come look at it. So he goes over and his friend shows him what he describes as just the largest Excel sheet he's ever seen in his life, just a complete mess. And he looks like he's trying to track kind of his receivables. And he's like, you're billing something, what do you do? What do you actually do? He didn't know. He's like, oh, I work in non-emergency medical transportation and we transport patients and members from their medical rides back to their homes. And they tracked all of it manually in this Excel sheet. And he's like, this is crazy. And he, really dove in and he sat in the back of transportation companies. He drove for them. He was in call centers and realized this is a pretty common problem where it's just an antiquated industry. People are doing everything by paper, fax. And he's like, we can automate this for you and digitize it. So that was really how Kinetik got started, was they built out the industry's first revenue cycle management platform. Wow. And then from there, from kind of all the experience he's had in learning for RCM, found the opportunity for a true end-to-end digitized infrastructure.
Wow. I love these type of origin stories, and it's so sad that Excel was the solution.
And it still is for many NEMT companies.
Really?
Yeah.
Wow, that's so interesting. So talk to me more about what are some of the biggest inefficiencies in the NEMT industry today, and why has this space been so slow to modernize?
Yeah, so like I kind of mentioned, the inefficiency comes from it just not being digitized. The systems aren't talking to each other. So there's a lot of fraud, waste, and abuse because everything's so manually tracked. We don't really know what's getting submitted. We don't even know if patients are truly getting to rides because it's just not tracked. So drivers can say, oh yeah, we did this trip. Oh yeah, we dropped that patient off. So there's a lot of fraud that goes on. And so members are just, unhappy. Health plans aren't able to track their data. And transportation providers, a real issue we solve with the RCM is getting them paid because it's such a cumbersome process. Right now, it actually takes 72 hours or 3 days to book a ride for a medical ride. So imagine, you're calling an Uber and they're like, oh, we can get you in 3 days. And that's because to get billed through the Medicaid process. So that's kind of what we're really solving for, is real-time medical billing.
Awesome. Denise, tell me, what role does technology play in making this more efficient for the people that are doing it?
Well, I think, as Elizabeth shared, it's a very antiquated system right now. It's getting better, but when you think about what we are trying to do to really advance the ability for somebody to be able to call a car just like you do today, an Uber or a Lyft, and you can have that vehicle take you to transportation, that just doesn't exist. But that's the potential, and that's what we're working on. Additionally, there's no GPS tracking. So if you put somebody you love in a car to go to a hospital or to go see their doctor, you can't see whether or not they made it if you're a caregiver like me. And so that's a challenge. So that is what we're doing. We're modernizing the ability to actually get the rides to people earlier and faster, be able to track the ride from end to end, and be able to visibly see that they made it on time. And then back in the back end, as Elizabeth shared on the revenue cycle management, we have proof and validation of the ride, which helps the transportation provider to be able to validate what they're doing and that it's a verifiable transaction with a member getting them to that place of safety.
Yeah. So the claims are getting approved quicker, so they're getting paid quicker.
Wow, that's amazing. And it's interesting you say that. Literally, when I came to this conference, I put my mom in her very first Uber that she's ever been in, and I was tracking her on the way home. And she's like, is this safe? But she was scared, right?
Yes.
She'd never done it before. And I was like, don't worry, Mom, I'm going to be tracking you. And I texted her. I said, you got there. She's like, wait, how'd you know? Right? Like but it was so foreign to her because she had just never experienced it. So it's interesting to do that. What are some of the other issues you see, because it sounds like there's silos of data across all the, these different providers of transportation. What are some of the challenges you see because the data is so siloed or in an Excel spreadsheet?
Right. Well, I think that is the biggest challenge. Our data is only as good as the data we ingest, right? We can't fix what we don't know about. And so in order to really understand what the drivers are going through, right, and having the driver, the apps talking to each other, having the ability to be able to see real-time tracking, GPS tracking, so that we know when we can validate a ride's occurred. And then, going back to the health plan, giving them the tools necessary so that it's running through the entire system. Just like humans talking to humans, we need our systems to talk to our systems. And today they just don't. And I think what Kinetik, ultimately, what we're really focused on is how do we break that down and really make it an interoperable system where it all speaks to each other. And ultimately, at the end of the day, the member really benefits because they're getting on time to their appointments, but also the drivers benefit, the local transportation providers, because they have a tool now that's verified and they get paid on time. They get paid quicker than 60, 90 days.
So it's something else too with like network adequacy, right, is the availability of rides. And a lot of the transportation providers go out of business because they're not able to pay their drivers because of that cumbersome process. So by able to get them paid, they're staying in business and you have a healthier network so more people can have access to those rides.
Yeah, that's awesome. I mean, let's hear some stories. I'm sure, with all the rides you've worked on, what are some of the real world consequences when patients don't have this reliable transportation to get to their medical appointments?
Yeah, I mean, the biggest consequence is they're not getting access to that care, especially preventative care. A lot of the rides we deal with are members that are, they're on Medicaid, they're going to dialysis appointments, they're going to mental health appointments, behavioral health. So when they're not getting those pre-treatments, then, their cases are worse and they're ending up in the hospital. And the hospitals, they're trying to get their beds emptied and they can't because they're so full. And then because they didn't have the preventative health, they're now there longer. They're in hospital stays longer. They have more serious conditions, need bigger surgeries, etc. And so that's kind of the consequence of not getting the members to their care. And an example that you mentioned, we're working in New Mexico. So we actually work a lot with like rural health populations and helping that network adequacy. And one of the things we learned specifically in New Mexico is it's one of the highest infant mortality rates because mothers can't get to their appointments. It's like 90 plus minutes to a hospital from a rural area in New Mexico. And so having the accessibility and availability of those rides and tracking and getting them there could really help.
Yeah, that's amazing. I drove 90 minutes to the hospital for my son. I understand.
Oh, wow.
That is a challenge, that's for sure. Denise, how does your vision and Kinetik's vision for this real-time healthcare rides compare to what we experience today? I mean, I kind of described my mom, is that where it's headed? Or, but obviously there's some other complexities with Medicaid reimbursement, Medicare reimbursement, those types of things. So, how does your vision align with what we experience kind of in our normal life, probably going to the airport after here?
Right, and our vision is exactly what you just described with your mother. Like when I put my 95-year-old uncle in a car, right, and he's covered by a Medicaid plan, I couldn't see. I had to call 72 hours, 3 days in advance. I couldn't see where he was. So it's very scary to think about that. Additionally, the drivers. If we don't find a way to map more drivers to rural communities where there is such a desert in transportation, if we don't find a sustainable way where they can really endure and have a good business model where they're paid on time, it's going to be extremely challenging to make a difference. And one little statistic, I won't put a bunch of them in here, but 21% in the United States of adults that need care, predominantly in the Medicaid, Medicare space, don't go to the appointment because they don't have transportation. So it's pretty striking when you think about it. So our vision of what you experience, what we all experience today with Uber and Lyft, is exactly where you want to go. Plus, the fraud, waste, and abuse. So we hear a lot about it today, right? So the revenue cycle management solution was the first solution built. And the intention of that is to really help the drivers, but in the end, what it helps is visibility, transparency on the ride, validation that it occurred, and gets people a much more assurance that they can count on NEMT as a solution. The last thing I would tell you is that most people don't even know NEMT exists.
I would say that's
so
true.
we want, even with, you can be reimbursed for gas mileage and reimbursement, but most people don't know that their plan provides this. And that's part of what we want to get the message out so everyone understands it's available. And also we have a solution that's much better and more modern than what exists today.
Yeah. And like Denise said, there's a lot that don't know about it, and those that do and have maybe tried to go through the process are so frustrated. And I mean, imagine booking that ride 3 days in advance and then your car never shows up, and the process right now is, member calls health plan, that calls a broker, that calls transportation provider, that coordinates with the driver. And it's just this constant cycle.
Yeah.
You talk about interoperability, like to that point. If you don't have the way to track all of this and that your systems actually are talking to each other, you can't really plan for demand. You can't really understand what you're going to need, what additional drivers are going to be there. If your RCM, if your systems are not talking to your app, to your GPS coordinates, and then really looking at the volume. And that is ultimately what we're driving to achieve, is a much different scenario that plays out.
Interesting. And I mean, as you described it, there's so many silos in that whole process that you just described. How does that, impact organizations, that are providing these rides and their member satisfaction, their NPS scores? Have you seen an impact to that, Denise?
Oh, absolutely. And that's the part that's the most challenging. Most people don't know it exists, but those that do and use it are often so frustrated that they're filing grievances with their insurance company, their health plan, their perspective on just how hard it is, because sometimes they don't get picked up. Imagine you've waited 3 days you have to wait this 3 days, you are going to an appointment, you don't want to go to the emergency room, you want to go to your primary care doctor, and you don't have a driver show up, and you can't track it, you can't see it. So it's absolutely a challenge.
Wow.
And then to your point of not knowing about it, our Sufjan grew up on Medicaid, and he often shares, growing up, they didn't really know what was available to them, and they don't want to ask for help. And so when something would happen, they'd call an ambulance, and then, they'd be in the ER, whatever, and then they'd get this bill for thousands of dollars, and they'd have no idea they were going to get that bill.
Wow.
And I think that's very common.
So on NPS, the other important point to know is that in the world of Medicaid, most health plans, the biggest impact to their NPS, their customer satisfaction, is transportation. So when the state and Medicaid organizations at the state level are looking to choose their health plans, they're looking at that. How well does the health plan look in terms of serving its members? And oftentimes what happens is that really impacts a health plan's ability to continue, and that's why they care so much. Along with getting people to care, they really want to make sure the experience is what they deserve, what's warranted and what's promised.
Yeah, and if you look more broadly, I mean, NPS is one thing, and then obviously patients is what matters most, and making sure they're taken care of. But how does it affect patient outcomes or even healthcare costs?
Well, there was I'm given another statistic. There was a recent statistic that it's about $150 billion impact when people don't get care. Wow. Because what happens when they don't get the regular care? This is preventive care. This is going to dialysis. This is maybe a serious scenario where you have cancer and you need to get to an oncologist. People who aren't able to get their preventive care or go seek that treatment are ending up, as Elizabeth shared, like in the ER. They're going back into a scenario where it's urgent and it's much more expensive, and they're not getting quality care because they're oftentimes not seeing the same doctor. And so it's just not a scenario that plays out very well. And in some cases, like our founder, Sufjan, they'll take an ambulance to the ER versus a transportation ride.
Yeah. Well, and I think we're also seeing, and this is my own anecdotal societal look, is that we used to have churches and community events, and now we drive into our garage and we never see the neighbor next to us. So we can't ask the neighbor to give us a ride. We need some sort of other alternative transportation. Families are living further apart, so you don't have family there to take you. So the demand for this, I think, is going to only just increase. So I appreciate you guys both coming in and talking with us, sharing this important area, and I love that tech is enabling such an important service. So I appreciate you taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks.
Thank you.
Thank you.